well-developed system that supports parents, childcare providers, and local communities. They're funded by the Department of Education, and they've supported their efforts since 1976. Local resource and referral agencies do a number of things, but I want to point out some of the most important parts. They partner with families to help them find and choose childcare that best meets their needs. So they're able to maintain a comprehensive database of childcare providers in their communities, mostly licensed family childcare homes and childcare centers. They also work with childcare providers to improve the quality of care and to maintain and expand the supply of childcare in their county. And so thus they provide training and other services that help childcare providers stay in business. They educate local communities and leaders to understand childcare issues and how to address the childcare needs. So some of you who are on this call may have, if you're with legislative staff, you may have received visits from your R&Rs last week. And the other thing that they do is they respond to the community's changing needs and refer families and providers to community services. So because the most important function is to support parents to find childcare that best meets their needs, they have a relationship with the Department of Social Services Childcare Licensing Division to receive data on childcare providers. And since the pandemic, the network received weekly childcare closure reports that we sorted and we give to the R&R so they could update their database on who may be closed. So one of our speakers will detail more of this in just a moment. So with that, I'm going to ask to flip to the next slide, which is our agenda for today. Sherry Zhang, our research associate, will walk you through what we have found from the data. And Sherry will explain to you the data that you're about to see and how we came to those numbers, and she'll go over the California Family Childcare graphs to illustrate. And we also have 3 other panelists who will join us, who I'll introduce now and later. Nina Boothie is the executive director of Every Child California. And they are also a membership organization of contracted sites who are contracted with the California Department of Education. So she'll speak a little bit about the California Centers graphs that you'll see. And then we have 2 other counties that will speak with us. Heidi Kaiser from Sacramento Child Action, and also Veronica Garcia from Stanislaus County Office of Ed Child and Family Services will speak about their graphs, and those will be both family childcare and center-based. So just a little logistics for our presentation today. We ask that you keep unmuted, but to use the chat function and to use that for your questions and comments. We will also use the chat box to include links that are relevant to the discussion. And if folks are interested, we will put the recording on our website up tomorrow. So with that, the next slide, please. So that's me, Linda Sato. And just a little more context before we jump into the presentation is that, it's been almost 1 year to date since our governor issued the executive order declaring the state of emergency, and he did that on March 4th. And, and that was because of the rapid spread of COVID-19 all across the world, and also certainly in our own state. And so that state of emergency declaration enabled the departments to prepare for a response. And you could see that each department, and I'm referring here to the Department of Social Services and the California Department of Ed, a lot of that is actually chronicled in their responses in their provider information notices, or what we call PINs, as well as the California Department of Ed's Early Learning and Care Division's management bulletins. And those are on their COVID-19 pages. And just like the color-coded tiers that affect businesses across every county in California, childcare policies also guiding for safety also affect the childcare field in different respects. And certainly the biggest policy that affected all of us in the childcare field was that March 19 executive order calling on all Californians to stay home. And that stay-at-home order, it changes the demand side of the equation that also affects supply, which we'll be talking about. And then other policies for operation that affect supply certainly include like the social distancing guidelines, group ratios, cohort sizes, and you'll see that in the slides, and we'll be able to talk about that through the slides. And all across the nation, the childcare supply plummeted as a result of the shelter-in-place orders and the loss of jobs, parents' job losses, certainly keeping children at home. And without regular income and having ongoing expenses, many of the childcare providers didn't have enough revenue flow or sanitation supplies to keep their businesses open, and some temporarily closed to exposure and then may have reopened. But the Center for the Study of Childcare Employment, they did a national report, and they reported that nationally the childcare industry was about 83% as large in October 2020 as it was 8 months earlier ago or 8 months prior to that in February of 2020. So that's a huge loss. And in California, the childcare sector also, while we were recognized as an essential services and efforts were made to continue to pay on state contracts or to provide cleaning services and supplies to help keep providers in business, we too saw some slippage, and from the graphs you'll see. So with that, I'd like to introduce Sherry Zhang to go over our California data. So with that, Sherry, take it away.
Thank you, Linda. Can we go to the next slide, please?
Next slide. Yeah.
So as Linda said, we created our COVID graph using data that we received from licensing. So I'll just be going over just kind of the methodology that we use. So we received 2 different types of updates from licensing that we use to calculate our graph. The monthly updates, which include permanent closures and newly open providers, as well as weekly temporary COVID closures list. So we use mid-month updates for each month. So for each month, we picked an update from the middle of the month around the 15th or 20th, depending on which day of the week that the COVID closures was sent to us. So can we go to the next slide? So this is just a small example of how we calculated some of our numbers. So using the temporary COVID closures list, that's a complete list of closures as of that week. So we would compare each month's files to the previous month to find new closures and reopen providers. So in this example, to find the August 2020 numbers, we compared it to July 2020. So if July 2020 had providers A, B, C, D, and E, and August 2020 had providers B, C, D, E, F, G, we knew that since the provider A was included in the closures list in July, but not in August, that this provider has been reopened. And providers F and G are newly closed providers because they were in August 2020 and not July 2020. And this would be a net change of -1. So overall, there's 1 less open provider in August 2020. Can we go to the next slide? So for both centers and family childcare homes, there are 2 graphs. There's the total number of licenses as well as the open and closed license graph. So by looking at the graph on the right on our slide, you can see how we calculated the numbers for the graph on the left, the total numbers. Also something to note is that these numbers are for the number of licenses. So because centers can have more than 1 license, our numbers are not going to be exactly the same as the total number of facilities. It's just the total number of center licenses. But so for the graph on the right on our screen, the red line are providers that have closed, and these include temporary closures as well as the permanent closures. The permanent closures, like I said, are providers that were included in those monthly updates, and then the temporary closures are the ones that we calculated using the COVID closures list. And then that blue line, the newly open providers, those were also from the monthly updates. And these are providers that did not have a license before, and this is completely separate from the temporary COVID closures. And then that green line are the reopened providers, and those are the providers that were closed previously temporarily because of COVID. So using these numbers, we found the total numbers to go into the graph on the left. So for each month, we would subtract that red line, the closed providers, and then add in the newly opened and reopened providers to find the new total for that month. So on the graph on the left, those two numbers in that circle, the negative 14% and that negative 3,600 number, these are the difference between the January 2020 number and the January 2021. So the start and end of our graph. So between January 2020 and 2021, there was 3,635 less providers, and this was a percent change of negative 14%. So as of January 2021, there were that many fewer active family childcare home licenses in California. And so this is just an overview of the California graph. So we have graphs for each county as well, but the methodology is all the same. And we can go to the next slide.
So great. Thank you, Sherry. And again, if folks have questions, if you could just put those in the chat and we could either answer them at the end by whoever is it's directed to. So next I'd like to introduce Nina Boothie, who will talk a little bit about what she sees in the California center-based graphs.
Hi, Linda. Hi, Sherry. Good afternoon, everybody. Thank you very much for allowing me to participate today. As Linda mentioned, my name is Nina Boothie. I am the Executive Director of Every Child California. Every Child California is a statewide organization that supports publicly funded early care and education programs. And so just really happy to be here today. As you can tell on the slide, and I'm going to be talking specifically about center-based programs right now. We had programs close in March. When the shelter-in-place order first began, childcare facilities were only able to stay open if they were serving children of essential workers. These included nurses, healthcare workers, grocery store clerks, childcare providers, and agricultural workers. As such, we really saw a tremendous amount of programs close during that time, again, as outlined on the graph. We had a number of subsidized early care and education programs, state-funded programs that never closed. According to our numbers, about 80% of families that are served in subsidized early care and education programs are themselves classified as essential workers and did not have the ability to work from home. Therefore, their need for in-person care continued over that time. Many school-based programs did close in March because of public school closures. They were not able to reopen if the school itself was closed. Most private programs did close unless they served a large majority of essential workers, since they did not have access to personal protection equipment, and there was not really concrete guidance from the California Department of Public Health at that time. In April, we see that programs started to get access to personal protection equipment and other supports that really helped them to open. A number of organizations across the state really gave some particular guidance in terms of how to reopen and how to reopen safely. There was an increase in COVID testing, and there were more concrete guidelines in terms of what would happen if someone in a program were to test positive for COVID. Centers continued to juggle health and safety standards and try to maintain quality and individual care as much as they possibly could. In May, the California Department of Public Health started to issue more guidance on reopening, and in early June, we saw that childcare facilities were allowed to reopen for all children, not just essential workers, if they met health and safety guidelines like wearing masks and keeping children in small groups and 6 feet apart as much as possible. In July, We did see an increase in cases and surges. There was an article from EdSource dated July 17th, 2020, where California child care facilities reported 5 times as many coronavirus cases as there were in June. Whenever a coronavirus positive case is issued at centers, depending on the certain, the parameters, whole entire classrooms, whole entire sites sometimes needed to quarantine. So you do see this ebb and flow, which represents itself on the graphs as well, in terms of how programs needed to open, reopen, close again because of exposures. Again, you can see that high blip in July when we saw a surge in cases. And then you see in August, again, the temporary closures has been reduced again, simply because those quarantine periods have been, were covered. Based on the graphs, we see that these temporary closures really do match what we know was happening with COVID surges at the time. And I will say that for childcare centers, as well as for family childcare homes, which I know will be mentioned a little bit later in this presentation, we do continue to see even today, whereas the line remains pretty solid in terms of, closed programs, i.e. most of centers have been open now. There is still this fluctuation that we see. You can see the blip in the graph in December of 2020, when increased COVID exposure did mean that programs needed to open and close. What that also does mean that centers have to spend more funding on cleaning, on operating, on personal protection, deep cleaning. We estimate it's around $10,000 per classroom when each one needs to be fully closed and fully open up again. Since March 2020, there have also been limitations on the number of children served in childcare centers. Group sizes are limited to 10, whereas prior to COVID, there could be group sizes of 12. With a teacher and assistant, you could have 2 groups of 12 together in a classroom of 24 children. Currently, you can only have one stable group of 10. As such, as people continue to go back to work in person when they're getting vaccinated, we're seeing that programs are continuing to open and stay open, but they do have to operate at this lower group size, and they are being continued to be held to social distancing rules and reduced capacities. We estimate that programs are running at approximately 30 to 40% of their total capacity due to these lower group size. Capacity of programs, centers will likely be down for 2021-22 year, simply due to some of these reductions. We highly recommend that the hold harmless clause be continued for the 21-22 year for direct contracting subsidized programs, so that programs can maintain their full contract funding while providing care to children under current guidance, and to increase enrollment during the aftermath of an outbreak. Private programs, private center-based programs should also continue to receive stipends as possible, and continue to receive additional stipends so that they can continue to operate also under these much reduced group sizes. As restrictions on group size are eased, new recommendations on group size should be based upon already existing developmentally appropriate ratios, and group size should be a multiplier of said ratios. As we open up, we do not want to inundate our providers with new standards. So again, our recommendation is to use the existing standards that we have here. And as we know, early childhood education programs have been shown to be essential for millions of children and families they serve, and particularly crucial during this public health and economic crisis. As the state of California continues its phases in reopening, early learning and childcare programs are going to be even more critical. We know also with the schools opening, they're going to be even more critical for our state's infrastructure. Early care and learning program success is contingent upon receiving robust investments that are needed to take the necessary steps and precautions to reopen and continue to serve children and families. So we urge the continued allocation of substantial flexible funding directly to the child care and early learning system in California for both subsidized and private child care centers. So thank you very much, Linda.
Thank you, Nina. So the next, can you advance the next slide? And we'd like to invite Heidi to talk a little bit about what you're seeing in this graph for Sacramento.
Great. Thank you so much for inviting me to speak about Sacramento County and what childcare is looking like based on these graphs. So just give a little bit of a background, just for a little context. So based on the network's 2019 portfolio data, Sacramento had the capacity to serve 26% of Sacramento's working families. So as you can see, there was a significant gap even prior to the pandemic. So the graphs show that the pandemic has continued to further reduce that already inadequate supply. Just to give you a little bit of a snapshot of something we were sharing in our December 2021 data. So a total of 17.9% of our programs were closed either permanently or temporarily. 9.2% of our family childcare homes were temporarily closed, and 8.2 were permanently closed. And then within centers, 16% of our centers were temporarily closed and 3.3% were permanently closed. So we've seen a continuous increase in closures over the last year. It's differed at different times throughout the year, but private childcare programs are being heavily hit by the pandemic. For example, during April and December of 2020, Sacramento County permanently lost 1,884 childcare spaces. So that's just based on our permanent closure information. And we foresee that figure getting a lot higher if we don't receive significant support. So we continue to see our childcare providers struggle due to the cost of sanitation supplies and being able to access it, and that reduction in enrollment of children. So looking at the family childcare home graphs, we can see that a lot of our family childcare homes have continued to serve our families throughout the pandemic. We see some trends. For example, there seems to be a strong correlation between when childcare providers are receiving those stipends for supplies or for the other stipends that we've received from CDE and CDSS, we've seen a reduction in the number of temporary and permanent closures during those periods. But as we see those funds kind of dwindle out, we see more temporary and permanent closures. Showing that our childcare providers are continuing to operate on those razor-thin margins. And though we are seeing some family childcare homes get licensed, open, we continue to see that it's not really replacing the supply that we had prior to the pandemic. And the SIP program continues to be really important, a critical support for our family childcare homes. We really hope that additional funding that the network's asking for is given to continue funding that program at a significant increase in the hope that we can continue to rebuild the supply we're losing. When we look at the center supply graphs, we see a couple of things. So there's a huge loss, a large increase in the temporary and permanent closures between February and March. So we looked at the difference between the centers that we support that are private centers versus those that may be on school sites. It looks like 40% of the centers that we support were on school sites. So they closed when the schools closed. That's what we saw, and some of them reopened when some of the restrictions were lifted, and that's what we see there. So we see though that it's kind of fairly stable after that point. It seems like there's still though a concern that with the loss of any center, particularly some of the large centers, we're losing a significant amount of childcare spaces. So for example, during December, we lost approximately 11 childcare centers permanently. That equated to about 600 childcare spaces. One thing that I really want to emphasize based on what we're seeing is that something that we've been looking at in our resource and referral, that 37% of family childcare homes and 7% of centers that identified as temporarily closed during COVID have actually permanently closed since. So it really shows that we need to get that significant support to those private childcare facilities sooner rather than later. We also see that some of the supports that we're getting are really great, and we're really grateful for the supports we're getting from the state, but they're serving as a little bit of a band-aid to help if we're getting a couple of grants here and there. It's been a great way of serving our providers, and they're super grateful for that. But it's merely holding them over. For example, Sacramento City helped with a number of small business grants to some of our providers last year. That was a great support, but it just held them over a little bit longer. Likewise, although we haven't received funding from the county as of yet, they just approved $1 million to childcare providers for stipends, and the grants range from $1,000 to $2,000 based on whether you're a center or family childcare home. And these are great supports for our providers, but they're merely helping them survive, I guess. Yeah, and we really appreciate that the subsidized, those providers that accept subsidized children are getting the funding based on enrollment rather than attendance, and we really hope that that funding continues. But there is that concern for providers that haven't been accepting subsidized children. If they're losing families, which a lot of them are, just because of health and safety reasons or just families working from home, they're losing that income that they would usually receive. Yeah, and I think so some of our families are kind of maybe selecting smaller family childcare homes or FFN providers just because they may feel more comfortable at the moment to send them to settings where they're not mixed in with as many children. Yeah, I think that really concludes my comments. Thank you so much.
Thank you, Heidi, for that, for the insights and for the explanation also of what you're seeing in these graphs. So next, I'd like to invite Veronica Garcia from Stanislaus.
Hello, everyone. Again, this is Veronica Garcia. I'm a director at Stanislaus County Office of Education, and I oversee our state quality programs and some of our Head Start components. But surprisingly enough, when you look at our charts, I think that's why Linda asked us to present because of our actually low numbers here compared to others, is if you look at our first chart, you can see that over the past year, we have actually been able to kind of stay even. We did lose obviously some providers, but we've obviously, with a 2% decrease, have been able to recruit new providers. And that's largely to our SIP program that we have funds to constantly recruit, and this year has been even better for us. Although some family childcare home providers have closed due to reasons, obviously to COVID, or some, have mentioned, I'm in retirement age and this is just not worth it for me, I'm just going to close. Or, various reasons, they're just, different scenarios, whether there have been some health issues or just the opening and closing has affected them. But as you can see there on the first chart, less than 5 there, we have actually permanently closed, but again, have been able to recruit as well. That's why the numbers look a little, I guess, positively for us. The second chart, which is the opening and closing of the family child care home providers. You can see that the peak was in March, obviously, the peak of the closures. But again, we're constantly recruiting through our SIP program and other sources. And because of the essential worker funds that we received as well, because we are the County Office of Education and run a few programs, we were able to make those connections and able to connect them with their current family child care home providers or current centers that are, able to get more essential workers that these funds were for, that we were able to keep people open because they knew we were here. They knew we had the funds and the need was there. So for that, again, there were some permanent closures, but then again, there was some temporary closures, and then they slowly reopened. And I'm going to say that I think the reason why we had so many that reopened again slowly but consistently was due to the fact that we partnered with lots of community organizations, specifically First Five, and obviously R&R and other programs that we have here in the County Office of Ed to make sure that the centers, the family child care home providers, and the community had a place where they could call. They felt comfortable calling. We have a good relationship with the community. They know we provide so much professional development, SIP program, R&R, Head Start. I mean, we have lots of programs. So we were able to make those connections there, and they trusted us. But one of the main things I was mentioning was the reason why I believe they slowly opened, but did open, most of them, was due to the fact that we helped them with all the PPE supplies. We did have those that, had those concerns like, I can't find, wipes, sanitation wipes. I can't find the necessary PPE or the necessary sanitary essentials that I need to keep my family child care home or center open. And we were able to connect them either by providing it directly to them or giving them some sort of resources. We partnered with First Five that received lots of the cleaning supplies, and we had massive distributions where we would have lines of cars and we would just put them in with everybody, using masks, doing what we needed. We had an assembly line. People knew what time to come, and in the back of our building, we would put, all the sanitation, the PPE, the cleaning supplies, even training materials needed in their trunk. They'd come in, check off their name, put what they needed, and they knew we were here. So that's why I believe, again, we did have some reopen, most of them reopen. The third slide there, the Stanislaus County total center licenses. Most of these, obviously, there was a big dip there in March, April, but we believe due to the school districts closing. We have lots of our subsidized, children in school districts. So if they were closed, we were closed as well. If the school district, they follow what the school districts do. So that was the main reason there. The last one, was the 80 that reflected in March was due again to school-based closing and faith-based closing as well. A lot of our faith-based centers were around that time. And for the most part, a lot of our private centers remain open. The things I mentioned earlier, that was mostly due to, again, lots of the supports and all the communication that was for them. So I think that might have covered all graphs, unless anybody has questions.
I love my.
Great. Thank you so much, Veronica. And I'm just going to ask again if folks if you could unmute, or if you could mute yourself. No, if you could mute yourself if you're not speaking, just so that we have just one person speaking at once. And feel free to to ask questions in the chat box, and we will ask the panelists that. And while you're thinking about that, just want to say a couple things. One is we did put in the chat box the link to the county graphs. If you're interested, they're on the network's webpage. And we will also put this recording on there a little later. And I'm going to ask Nina and any of the other speakers, if there are specific recommendations that you want us to post on that website, we will do that, as I think we have many, as you've heard from the speakers. But so as people might be thinking about questions, I wanted to ask, any one of you can answer this, but do you suspect the trend is the same for subsidized and non-subsidized sites, just this either shrinking or reopening? Any thoughts on that, any of your speakers?
This is Nina. I have a few thoughts. My guess is that our direct contracted centers, there were very specific specifications in terms of their continued funding. So they had to reopen for either in-person learning or for distance learning. So because their funding is more closely dictated by the state of California, those particular rules were put in place. So I believe that to be the case for our direct contracting center-based programs and family child care home education networks. I would say that is the funding for 21-22 would need to remain in place. So programs would need to maintain that hold harmless in place, because as I mentioned, we're estimating that programs are only operating about 30 to 40% of their overall capacity right now. So certainly if you're only being paid for 30 or 40%, but you're having to operate 100% of your program, and you're having to do spend these additional pieces with testing, cleaning supplies, et cetera, there's no way that you would be able to stay open. I would defer to some of my other colleagues about the private centers, but I do know that private centers are struggling. Some of them are getting stipends from city and county governments. Some of them are, if they do accept voucher children, they are being paid for those. And there are some stipends for non-operational days. So if they do need to close because of a positive COVID case or things like that, I would say they're largely insufficient. And so I do think that if those continued subsidies do not continue for the ongoing year, we will see a dramatic decline in total center-based and family child care operations, simply because there will not be enough enrollment, attendance in order to be able to stay open.
Veronica or Heidi, do you have any thoughts about that?
No, I just completely agree with what Nina mentioned right now. You know, our subsidized programs obviously have some mandates, and they have the funding, but the private centers and others need to continue to receive the stipends and you know, the necessary referrals that we give out through the essential workers funds that we receive through alternative payment, through all our funding sources, as well as you know, there is a need. People are still working and still need the childcare. We did hear from some parents sometimes that, you know, they were only given from their employer 2 weeks to find childcare, and it was pretty dramatic, I guess, for some. And of course, any of us would be as parents to have to find childcare in 2 weeks and not be able to find it or look for somebody to assist you with, you know, payment. So definitely, I agree with Nina's comments that we'll need to continue to receive the same funding and the same hold harmless things that we have in place now.
Heidi, did you have any comments on that?
I just say that, yeah, I wholeheartedly agree with that. And we definitely need to keep ensuring that any of the stipends that we get are getting out to providers that are not necessarily serving subsidized children as well.
Mm-hmm. Are any of you And I also welcome any of the participants, if they want to put this in the chat too. What are you hearing from parents? And what are you hearing from providers at this time? Are there major concerns either about finding childcare or worried that they're not going to find childcare, or also just what it will take to keep open?
I know that what I'm hearing from some of my members is depending on which community you are, so we're a statewide organization, what I'm finding is that with the reduced group size that centers and family childcare homes need to operate with, and with the increased openings and vaccinations, et cetera, what we're finding is that programs are bumping up to that ceiling of the number of children they can serve in actual in-person care. They do continue to offer distance learning, but distance learning is not very helpful if you need a safe place for your child while you are physically at work. And so certainly as numbers go down, we will need to see at some point those restrictions from the California Department of Public Health. We need the group size to be increased so that more children can actually be served. We do know that certain counties have also imposed stricter group sizes than the California Department of Public Health, and center-based programs and family childcare licensed programs need to go by the stricter guidance. And so again, I would say that that is certainly an issue that we are bumping up against now, that we're maximizing the amount of in-person care simply because of those guidelines right now. So I would say that that would be something to consider to, again, look at for opening up, because as we're looking at the graphs, even if you have a new center or a new family childcare provider who is opening, they are also only opening at that reduced group size. So their enrollment is only going to be 30 or 40%. So you are not going to have new programs opening right now because it's an impossibility. You can't operate on those margins. Like Heidi and Veronica were saying, the profit margins are so slim anyway that, I mean, that's almost an impossibility. So I would say that that is something that I'm seeing, and families are getting frustrated, especially if they previously were enrolled in an in-person learning opportunity. They did go to distance learning because of, shelter in place and fear and worry about their child. And now with things opening up a little bit, again, the vaccines rolling out, the testing being a little bit more available to folks. Schools, especially schools for our younger children, are starting to open if they've not opened already. So we really are seeing that need for both the younger school age care as well as our 0 through 5 population. Again, we're starting to see a increased desire for that. But again, with those limitations, we're finding that those children do not have places to go, especially when they were previously enrolled. Again, they don't have a place to go. So it's going to be really, really challenging in coming months unless we alleviate some of that restrictions.
Mm-hmm. Absolutely. Thank you for that. Heidi or Veronica, was there anything that you wanted to add to that?
I don't think so. I did mention, obviously, that some parents that we have heard from are a little stressed out, as we can imagine, and given a short time frame to find the childcare needed. But as Nina mentioned, they might find the childcare, but it's not the childcare that they need every day. So maybe they can only go there a few days a week, and then they have to find alternative childcare somewhere else. And then somewhere they have distance learning, and that provider maybe isn't too comfortable with helping with distance learning, and they have to now get an assistant to help the child distance learn it. And it just has become a little more challenging. But those are some of the things we're hearing from parents. It's obviously childcare was challenging before. Now it's gotten a little more challenging and frustrating, but hoping that it gets better.
Go ahead, Heidi.
Sorry, yeah, and I generally agree with that. And One thing that it was interesting that one of the staff from R&R on the advocacy day just now was discussing with myself and some of the legislative staff was the fact that sometimes our providers just may not be like I just mentioned the SIP program. Our providers may not necessarily be aware that the support is still there with the SIP program and that the other additional supports with helping future capacity building. It's really important, I guess, for us to really get that information out more to providers so that they know, well, you can still start up a family childcare home during the pandemic, just so that they have that information there and ready. And I mean, I know in Sacramento County, we have seen still a good number of family childcare homes open. And they really have been the people who have mostly been supporting our kids during the pandemic, just because maybe it's a lot easier, I would imagine, to operate a business in your home as opposed to all of the additional costs on top for operating a center. So yeah, it's interesting that they it may just be sometimes information that we need to just get out there more for our providers.
What do each of you think are the prospects of reopening those that have closed? So, you know, all the graphs have shown a net loss, which is devastating. I think, as you know, as I think Heidi, when you translated that to the number of slots, childcare slots, that is. And so in addition to building new sites and supporting those that are open through the, as you mentioned, through this childcare initiative project, just curious, are there other things that we should be doing to help those that have closed to reopen? Any and I think Nina, you're absolutely right about lifting some of those restrictions on group size and whatnot. But are there anything else that you think that will help bring back some of the ones that have either temporarily closed or have said they've closed?
I think some of the asks that we've been seeing at the state level, some of the ECE coalition asks, the workforce development, the getting those the reimbursement rate up. Those are crucial things for us to keep the childcare providers and to attract new childcare providers into our system.
Mm-hmm.
So I think, Linda, with this pandemic, you know, there's obviously negative things, but there is something positive. I think our childcare community has, as well as teachers, right, in general, elementary school and all around the state and the country, they're being seen as essential to the working families, that if you don't have childcare, you can't go to work. So I think that fortunately, like we saw in our charts, we didn't lose too many. The ones that we lost were more to retirement or just COVID fears, or just, you know, it just got too challenging. However, I do think, as I mentioned before, that our Child Care Initiative program, our SIP program, did help with recruitment, because we did open some during the pandemic. So if we could get some additional funds in that program and continue and increase, as we were saying, the reimbursement rates, I think we all agree with things like that. But as far as people that retired or just got too scared because of COVID, I mean, I don't think there's anything really we can do about that to bring them back, but the additional funds for the other programs to recruit more would be ideal.
And I would just add, I think we all know that once you lose a childcare provider and a childcare provider stops, it is incredibly hard to get them reopen again, whether it be in a family childcare home or whether it be in a center-based setting. It is incredibly hard. So in order to retain the number of providers we have is absolutely crucial. So that's why reimbursement rate reform is absolutely necessary. We are not paying people for the cost of care currently. It is an upside down business model that we absolutely need to address. We need to continue the hold harmless for our programs for 21-22. We need to continue the non-operational days for our family childcare homes and our AP providers. We need to ensure that they are made whole, because we cannot continue to lose the numbers that we have been doing, and we will never be able to recruit new individuals into this field unless we start actually paying for the real cost of care. And that is just a reality. And unfortunately, we all do know that, you know, we really, childcare is paid such a poverty rate, and we're asking these wonderful providers to subsidize it for the state of California. And so that's the reality. And so we really do need to increase our rates. That's the only way we'll be able to stabilize our childcare system and increase the number of providers that we have.
Absolutely. High five on everything she just said. I also want to just point out in the chat, and maybe I'll read this for our audio recording. This is from Dion Erner. Family childcare providers need to be paid to enrollment through the budget year. They need more COVID closure days. They need distance learning assistance. They need additional funding beyond stipends. It needs to be higher to start looking like the minimum wage, if not a living wage. And they need to see stabilization of rules and regulations. The management bulletins need to stop. Jill Johnson, schools will only return for 1 to 2 days per week, so providers need to be assured that they'll be paid for the days that children are not in person for school. And school will only be back in session for about 6 to 8 weeks, and then summer break. There is so much anxiety about the impact this disruption will have on children. And from Deneen Colburn, wholeheartedly agree with Dion. We need to demand that childcare be addressed at the same crisis levels as school reopening. So I think all of us, and I thank you all, the participants in the chat as well, that we're all very concerned about the dwindling numbers of the childcare supplies, which affect the ability of parents to be in work and able to work, and then just the woefully inadequate reimbursement and the ability for providers to be able to survive in this business. So they are an essential part of our ecosystem for our economy to get back on track. What we've been talking here about all the different policy supports that the state can provide to shore up that that supply, to strengthen the providers and their ability to earn a living wage, and certainly for the parents who are participants in this. So I wanted to close this session by first maybe saying if there's any other comments that you want to make, Heidi, Veronica, and Nina, and then I'll also point you to some of the resources that we have. So Heidi, do you want to go first? Any last thoughts?
I guess one point I did want to reiterate is that really concerning point that I shared about how many of our temporary closures have become permanently. It really shows how critical it is to get that funding out really, really soon. So we just really need to be pushing to get that 300 million out and continuing to push for long-term funding.
Thank you. Veronica?
Well, thank you again for having me. I think I appreciate everybody advocating for our childcare field, and specifically for family childcare home providers, private centers, and state programs, subsidized programs. I think one of the challenges that we have to remember that we are the people who should interpret some of these management bulletins that come out and ensure that we are letting our subsidized programs know exactly what they mean. And it has been challenging because there's so many. And hopefully everybody's been able to keep up with the changes. I know sometimes it's a little difficult, but we'll continue to do the best we can to ensure that our early childhood education community is seen in the way, like we were saying, like the rest of the districts, and the importance of early childhood education, I think with this pandemic has actually been increased. So that's a good thing. Thank you, everyone.
And I'll just build upon both of these wonderful ladies' comments. Absolutely agree. And if we could look at the silver lining of the pandemic and just really see that childcare, early learning has really gotten a spotlight, and it has been deemed essential, and people really do understand that it is an underpinning of our society. And so hopefully we are able to build upon the momentum of this moment to really get the dramatic reform that we have needed for probably 25 to 30 years now. So if we can have a silver lining, let's do it and really take the momentum of all of this in order to right the ship so that we're not losing any more of our wonderful providers, that we are seen as professionals, that everyone does really understand how critical childcare is and early learning.
Great, thank you. And then if someone could advance to the last slide. So I think I put this earlier in the chat, and you can also find this on our website, is the COVID-19 statewide and county by county graphs, again, month to month from January of last year, 2020 to January of 2021. And some information about the Child Care Initiative project that was referenced here by some of our speakers that helped build the supply and support the home-based providers. And then a couple years ago, the R&Rs received what we were calling Child Care Initiative Project expansion grants. That was because we were the state was seeing the decline of licensed family child care homes, and we were able to get one-time expansion grants, and they were hugely successful, actually increasing the supply by 43% from the previous year. Prior to that expansion. So again, really effective and efficient use of dollars there. And then the last link there is the childcare supply and demand that we produce the childcare portfolio every 2 years. And up on our website is an interactive data tool where you could even compare county by county, or actually see going back from to 1997 what the childcare supply and demand looks like. So with that, I just want to say thank you all for your participation in today's presentation, and thank you presenters for sharing your knowledge and expertise with all of us. So thank you so much.